its residents in mental health and substance abuse disorder parity cases. You also communicate with other advocacy groups across the country that are engaged in similar work. Based upon your experience, what is the most common type of potential parity violation you encounter? Or are there a few different ones?
Thank you for the question. There's no question, as I said, that among the people we represent, mental health and substance use care is harder to access than other types of care. That's our experience, and that's the experience that's communicated to us by other advocates and providers out across the country. The insurance limits that we see most frequently are things like arbitrary limits on things like residential stays for substance use disorders. We see, we've seen several patients, for example, who've lost their coverage for residential substance use treatment regardless of their condition. After 2 weeks. It's like a hard stop, and then that's it, and then services are stopped. So that's something that we see as a significant barrier. The full range of scope of services is also something that we see not being provided to consumers. So especially intermediate services, intensive outpatient services, again, residential care and other types of services that aren't acute and aren't outpatient are very common. As I mentioned, we also see unusual limits on medication-assisted treatment that seem to be arbitrary and don't necessarily align with what our review of the medical necessity requirements are. So those are some. Also,
So when you raise the issue with insurance providers, typically is it remedied or is it a fight?
So, you know, it really runs the gamut. When we talk to health plans on behalf of our consumers, sometimes we are able to remedy the problem. We'll be able to provide a certain amount of information or provide some clarity on the situation or an analysis of the parity law in some cases, where we may say, we think that this process counters the parity law and the health plan will change its course. In other situations, we'll go to appeals internally with the health plan, externally, and we'll raise the issues that way. And in a good portion of the cases, those appeals do result in an overturning of the decisions that are made by the health plan. So we have a pretty good record, I think, a very good record actually, when insurance denials occur in changing the outcome.
It's really too bad that folks need an advocate at all, because they are dealing with the personal issues every day, and thank you for what you're doing.